how are you? This is Glenn Gruby with Functional Health and Acupuncture Institute. Today, I just want to talk about a test that I find very useful for helping to get to the root cause of brain-based conditions like anxiety, depression, even chronic fatigue, and kids with things like ADHD. It's called an organic acid test. What this test does is it helps us to understand the root problems with somebody's metabolism that may lead to some of their issues. So in proper metabolism, we want to take a substance, for example A, turn it into B. Okay? If we are having problems with our metabolism, we may not be able to do that. We may have that pathway blocked, and instead the body makes something C. And this is what shows up in an organic acid test. So if we see high levels of certain markers, it tells us there's a metabolic problem, and then we can devise a strategy and functional approach to help try to correct that. Okay? So when we look at emotional disorders, we're looking for inflammatory triggers that are going to lead to that. Things like gut dysbiosis, inflammation of the gut. We're going to look for nutrient deficiencies. We want to see if there are toxins that we're not be able to get rid of. We want to see if we have problems with our genetics, such as the MTHFR gene can cause problems with our nutritional balance. We want to look at poor cellular production, if we have mitochondrial issues, and we also want to see if there's food sensitivities, because all of these things can interrupt and interfere with how our brain makes neurotransmitters and stop that process. Similarly, when we look at kids with neurodevelopmental delays, we want to look at the same thing, gut dysbiosis, toxins. We want to look at our genetics and food sensitivities to see, because all of these things can lead to brain inflammation, which will give us problems. Okay? So the organic acid test is very useful for this because it checks for dysbiosis, such as yeast, checks for B vitamin deficiencies, gives us a window about mitochondrial dysfunction, how well we're producing energy, can give us a window into neurotransmitter imbalances. It can tell us about how well we're detoxifying and producing glutathione, which is our master antioxidant. It can give us clues if there's problems with ammonia toxicity or oxalates, which cause lots of brain-based issues and pain in the body. So commonly when we do this test with these patients, we'll see things like high yeast and Clostridia markers. We'll see high oxalates. We will see mitochondrial dysfunction, poor utilization of fats, carbs, or proteins. We may see, or you often will see, low or high levels of neurotransmitters and low B vitamin markers. Okay? So just a short example is a case study where I've used this test. A teenage girl, 15 years old. She was suddenly diagnosed with bipolar disease. She really seemed to be healthy, but she had a little bit of a kind of a high sugar diet, had some toxic insult, overnight got a diagnosis of bipolar. Didn't really know why. We ran some tests. We ran the urine organic acid test, we did a food sensitivity test, and we did a genetic test on her. And what we found from the organic acid test was that she had high yeast and bacterial overgrowth, a lot of yeast. We saw high oxalates. We saw very poor mitochondrial function. We saw low B vitamins, poor utilization of CoQ10, and she had high ammonia levels, which is pretty toxic. It's a problem. We also, from her food sensitivity test, saw many food sensitivities, including sugar and food dyes, and we saw that she did, genetically at least, have a predisposition to difficulty detoxifying things. So based on these findings, we treated her gut, got the infections, trying to treat the infections. We changed her diet. We started targeting nutrients that were, supplementing with nutrients based on the tests we saw. We supported her body's ability to combat inflammation, which was very important. And what we found is it didn't take too long, but we were able to get her back where she was getting back to school. Her behavior normalized. She was able to get off her medicine. She was able to stay off the medicine as long as she's staying strict with her diet. So it was a really good result, really good example of an application of this test. So in summary, when we want to address the root causes of imbalance, we need to look at yeast and gut problems and systemic inflammation. We need to look at nutrient deficiencies. We need to see how well their mitochondria are working. We need to look at how well they're detoxifying. And we also want to look at food sensitivities. And grains in particular can be a problem. Okay? So the organic acid test is a really useful test for identifying a lot of these problems. So I hope this video helped. I hope you learned something. Keep watching for more videos. Thanks for watching. If you have any questions, you can call us or look us up on the web at fhainstitute.com. Thank you very much.